Hello, PeopleCare family. This is Lauren Chevalier, co-CEO of PeopleCare Health Services. As the state of Colorado and the federal government are actively taking steps to help weather the coronavirus storm, here at PeopleCare, we too are taking steps to ensure the health and well-being of the PeopleCare family. All of you, our clients and employees, remain top of mind and our highest priority, and we're committed to acting thoughtfully and courageously despite the disruption and uncertainty the coronavirus brings to our daily lives. The coronavirus situation continues to receive significant public attention from the news media and online commentators, to workplace discussions and dinner table conversation. Misinformation is present from sources that are overly optimistic to those that are overly pessimistic. Therefore, it's important to get the real facts from reputable sources, including the World Health Organization, the WHO, the Federal Center for Disease Control and Prevention, the CDC, and the Colorado Department of Public Health and Environment, CDPHE. It's also important to keep the current situation in perspective. So to that end, I want to share with you some positive signs. Let's start with China's experience. The first reports of coronavirus in China were announced in early January, and it's tapering off now, about 10 weeks later. In China, new cases are now on the decline, and business activity is coming back online. Life isn't fully back to normal yet, but things are clearly headed in that direction. That means that this disruption in our daily lives here in the United States won't last forever either. Personally, I'm hopeful that 8 to 10 weeks from now, things will be calming down here too. Current reports from China show that 40% of those who've caught the virus had very mild symptoms and have now recovered. Another 40% had more serious symptoms and have also now recovered. 16% are still showing positive for the virus and 4% have died. There's been a total of 80,000 reported cases and 3,100 fatalities in a nation of almost 1.4 billion people. If the incidence of the disease in the United States turns out to be comparable to that in China, then the odds would essentially be 17,000 to 1 that you won't get it. And the odds of the average American surviving the coronavirus epidemic would be almost 440,000 to 1. Those are really good odds. Should we expect our experience to be exactly the same as China's? Probably not, but I suspect it'll be close. So you should be able to rest a little bit easier knowing that the odds are strongly in your favor. Here's some more favorable statistics. According to the CDC, since 2010, the number of Americans getting the common flu has ranged from 5% to 20% of the population annually. That averages out to about 40 million cases of the flu every year. While it's still early, the incidence of the coronavirus pales by comparison, with the number of Americans testing positive for the coronavirus having reached 2,200 cases nationwide on Friday. Yes, this number will increase as testing becomes more widely available, but if China's experience is any indication, the incidence of coronavirus shouldn't come anywhere near the normal annual incidence of the common flu. So odds are that you won't get the coronavirus. But part of that depends on you. The old saying, an ounce of prevention is worth a pound of cure, is certainly relevant today. So keep in mind that by taking good precautionary measures, including avoiding large crowds, practicing good hand hygiene, and regularly disinfecting high-touch objects, the chance of coronavirus infection is significantly reduced. Stay calm amidst the hype of all the news reports, and in the off chance that you or someone close to you shows signs of flu-like respiratory symptoms, be sure to call the PeopleCare office to let us know. PeopleCare has created the PeopleCare screening tool based on the latest guidance from CDC and CDPHE. You should have received an email on Friday evening with a copy of the screening tool and instructions for how to use it. We'll also be making several modifications to our daily operations to allow us to continue to serve clients and their families while prioritizing client safety and the health and well-being of our employees. As we navigate this dynamic situation, community by community and client by client, we'll temporarily be modifying how we interact with clients, including replacing recertification, continuing stay reviews, and on-site 90-day supervisory visits with telephonic or video conference-based communications. But rest assured, clients will always be able to reach us by calling the PeopleCare office main phone number. Other promising developments include state and federal governments committing to make the full coronavirus tests for symptomatic individuals available at no cost to the individual, regardless of whether or not they currently have health insurance. Additionally, there's discussion at a federal level about temporarily reducing or eliminating the payroll taxes that get withheld from employees' paychecks. And efforts are also underway to provide expanded unemployment benefits for unemployed workers. On multiple levels, the whole country is coming together to help everybody weather the storm. Here at PeopleCare, as this situation develops, we'll continue to be driven by doing what's right to support our clients and our employees. PeopleCare and the PeopleCare family are but one small part of our overall healthcare system. But in the spirit of all the brave and courageous healthcare workers all across the country, you and I and all of us need to stand shoulder to shoulder with them. We need to keep doing our jobs to make sure we don't let those down who are depending on us. Hang in there. It's not springtime yet, but I can see it around the corner. And you can too if you're looking in the right direction. Keep your eye on the coming of spring and the rebirth that comes with it. We will get through this together, and we'll all rejoice when we do. In the meantime, stay safe and be well.